This is a big table in your book with a lot of information and very little visual help. But I want you to remember what we're doing here is looking at an organ, whether it's a gland or the heart or an organ with smooth muscle. We're going to look at the name of the organ. We have to learn a little bit about what that organ does. Then what I want you to think about is what would the body want that organ to do during a sympathetic response, maybe in an emergency or during exercise. And then what would the body want to do with that organ at rest? Sometimes we have to look at both of these, the sympathetic action on the organ and the parasympathetic. A lot of times you just have to remember one or the other. So let's begin with the adrenal medulla. That's the inner part of the adrenal gland. All we really need to remember is that the adrenal glands produce norepinephrine and epinephrine. And then you ask yourself, when would I want that adrenal medulla to do that? And it's pretty straightforward. You're going to do that during emergency or fight or flight responses. So the adrenal medulla secretes epinephrine and norepinephrine when sympathetic stimulation tells it to. There are no parasympathetic neurons going to it, so we don't have to worry about parasympathetic. Second organ, lacrimal glands. They produce tears. Tear production is parasympathetic. So it secretes tears in response to parasympathetic stimulation. Little bit of tears during sympathetic, but we don't need to worry about it. Let's disregard that. Next one, pancreas. Now the pancreas is an organ we haven't really talked about. We learn a lot more about the pancreas in A&P 2. But I want you to already remember a little bit about it. One function is to produce digestive enzymes. So when you see digestive enzymes, you should think parasympathetic. So it secretes digestive enzymes when parasympathetic neurons tell it to. Sympathetic will inhibit that production. So you don't want to produce digestive enzymes during emergency situations. So that's one function, digestion, digestive enzymes. The second function is blood sugar regulation. It regulates blood sugar by producing two hormones. One hormone raises blood sugar. That hormone is glucagon. So raising blood sugar, you should think sympathetic, and that's glucagon. The other hormone is insulin. Insulin lowers blood sugar. That's a storing of glucose. When you lower blood sugar, that blood sugar goes somewhere. It goes into organ cells and is stored. So the pancreas is a tricky one. That one you might want to make a note card. In that during sympathetic activities, it does not produce digestive enzymes, but it produces glucagon. During resting, it produces digestive enzymes and insulin. We're going to skip the pituitary gland. We're going to skip the pineal gland. We're going to go right to sweat glands. Sweat glands are stimulated by sympathetic neurons, but remember the big exception. It's cholinergic. Sweat glands have acetylcholine receptors. Next one, adipose tissue. That's pretty easy. Adipose tissue stores energy. You want that adipose tissue to release that energy during sympathetic activity. So lipolysis occurs when sympathetic stimulation happens at adipose tissue. Break down triglycerides into fatty acids. Fatty acids are used for energy. The liver can be a tricky organ. So this is one we want to spend a little more time on. But the liver, one function of your liver is to be able to store glucose and release glucose. Releasing glucose is sympathetic. So it takes the glycogen, which is stored glucose, and converts it back into glucose. That's a way we can raise blood sugar. Glycogen into glucose, glucose into the blood. That's a sympathetic response. Parasympathetic is the opposite. You're going to take glucose from the blood and convert it into glycogen so you can store it. So storing glucose in the form of glycogen is parasympathetic. The liver also is in charge of producing bile. Bile is a digestive secretion. It helps with your digestion. So that should be parasympathetic. All right, so those are all glands. Let's move on to cardiac, heart. That's an important one to understand. The heart's always important. Whenever there's a heart, it's important. Sympathetic increases heart rate and force. The heart beats harder. Just think about what happens when you're exercising. Your heart rate goes up, your heart beats harder. That's so you can pump more blood, pump more energy. That is sympathetic. Now, notice I've added a little drug here. Beta-1 blockers are drugs that block the adrenergic receptor of the heart. Beta-1 blockers, or beta antagonists, reduce this. So they reduce the heart rate and reduce the force of the heart contractions. Parasympathetic decreases heart rate. That's done by the vagus nerve. There are also drugs called anticholinergics that can block this. One example is atropine. Atropine, if you inject it at the heart, will get the heart beating. It's often used to try to get the heart beating that might have stopped beating. But atropine blocks the cholinergic receptors, and if you block a neurotransmitter that reduces the heart rate, you might get that heart beating again. Next one, some smooth muscle organs. If you think about the iris controls your pupil. The iris actually has two muscles in it. One of them, its job is to contract, and when it contracts, it actually dilates the pupil. So we can probably cross out contraction because that might confuse us. But if you look under sympathetic, you have dilation of pupil. If you look under parasympathetic, you have constriction of pupil. That's the home run. Dilation is sympathetic. Constriction is parasympathetic. We've got drugs, anticholinergics, that we can use as eye drops that cause pupils to dilate. If you've ever had your eyes looked at and you've had your pupils dilated, that was an anticholinergic. It blocks the constriction of the pupil and hence results in dilation of the pupil. Ciliary muscle, that's the one that helps us focus, close vision. That's resting. Contraction for close vision. Then you got the airways. The airways are an important one. We've got a number of drugs we use to open up airways. They're collectively called bronchodilators. The airways dilate in response to sympathetic. Therefore, if you mimic that using a beta-2 agonist, you will bronchodilate. That's albuterol. There's another way to bronchodilate. You use an anticholinergic. You block the constriction. If you block constriction, it dilates. Examples, Atrovent and Spiriva. You've probably heard of Spiriva. All right, last one here, gallbladder. Gallbladder is going to be housing bile. Bile is a digestive product. So the gallbladder ejects the bile in response to parasympathetic, whereas you store more bile when you're sympathetic. All right, other organs. Digestive organs like the stomach and intestines, they increase their activity with parasympathetic. Spleen. Spleen's an interesting one. Let's go back to the spleen here. Spleen, one function of your spleen is to store blood. It's a very bloody organ. It's got all kinds of blood in it. In some cases, you want it to release or discharge that blood, like in an emergency situation. So this is usually in response to loss of blood. So if you were to get in that car accident and you hemorrhaged a bit, you're losing blood, your spleen will actually release blood into circulation. It's kind of a way to give you a little more time. So that's kind of an interesting thing that the spleen can do. All right, let's go down. These are all urinary. Ureter, urinary bladder. So those you want to think resting. So increasing motility, urine can move down the ureter a little better at rest. And then urination. Urination is obviously a major parasympathetic response. It's very hard to urinate when you're exercising or when you're in an emergency fight or flight situation. Reproductive organs we talk a little more about in AMP2, but erections are resting activities. Erections are parasympathetic. Hair follicle, so hairs stand up. That's erection of hairs is sympathetic. So notice a lot of these, you really, if you just remember sympathetic or parasympathetic, you can get by. Some other ones you kind of have to look at both. These are all blood vessels. We're going to keep this pretty simple. This is way overwhelming. This is TMI, too much information. What I want you to remember is vasoconstriction. Vasoconstriction is typically a sympathetic response. Now, the reason why that's important is a lot of times we need to treat people with high blood pressure. We call that hypertension. Hypertension is a chronically high pressure in the cardiovascular system, and that's not good for you. It's not good for your heart. It's not good for other organs. So if vasoconstriction increases blood pressure, let's design a drug that blocks that. And those are called alpha-1 blockers. Alpha-1 blockers are a class of drugs for hypertension because we're blocking the sympathetic response. The sympathetic response is vasoconstriction. Notice, a lot of vasoconstriction on this side. Vasoconstriction, 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 vasoconstriction. If we dilate as opposed to constrict, blood pressure goes down. So alpha-1 blockers are hypertensive medications because they can vasodilate. These are often referred to as vasodilators. Alpha-1 blockers vasodilate to reduce blood pressure. Okay, so that brings us to the end of the autonomic nervous system. It's not a long PowerPoint, but it's chock full of very useful information moving forward.